Welcome back to Part B. I gotta laugh. As you notice, I'm in my basement again. This is my main recording studio, and the reason why I'm laughing is I got about halfway through this section, and I realized I made a major mistake. And I went back. I was going to turn the camera off, and it turns out I wasn't even recording. But now I'm recording. Let's get on with this. When we were last together, we were talking about the adrenergic and parasympathetic neurotransmitters. And we left off with the alpha 1 and 2s, the beta 1 and 2s, as adrenergic neurotransmitters. But let's move on. And by the way, this is a very complex topic. And I don't expect you to have 100% comprehension after watching this video. I want you to watch this and get an understanding, a base understanding, or at the very least, develop good questions. On Monday, we'll go into this in greater detail and really get into this and help you understand completely what we're talking about. So, in other words, if you're a little confused, don't worry. We'll take care of that. There's a general term for substances that produce a sympathomimetic response. And these are the drugs that stimulate the sympathetic nervous system. There are endogenous and synthetic chemicals. Endogenous meaning things that are naturally found in our body. Epinephrine or adrenaline, norepinephrine, and dopamine are always found in our bodies in varying quantities depending upon what's going on. Synthetic catecholamines are not found in our body naturally. They are man-made. They function in a similar manner though. The two most common are isoproterenol and dobutamine. You also may hear it pronounced dobutamine. I prefer dobutamine because there's dobutamine and dopamine. If you go dobutamine and dopamine and say it quickly, you can confuse things, and they are different substances. So these drugs have one of three different effects. They could be a positive inotrope, a positive chronotrope, and a positive dromotrope. What does that mean? I mean, those are fancy words. What do they mean? Well, an inotrope makes the heartbeat stronger. It increases the contractility. It makes the heartbeat, it pumps harder and more completely. A chronotrope, if you think of the term chrono, means time. So a chronotrope increases the heart rate. It makes the heartbeat faster. A dromotrope affects the electrical system of the heart. It makes the AV and SA nodes, the conduction between the AV and SA nodes, to be more efficient, so that the electrical activity can transfer to the various parts of the heart better. So inotrope, more contractility, bigger pump. Chronotrope, faster pump. Dromotrope, better electrical impulse transmission within the heart. Now let's talk about the opposite type of drug. A parasympathomimetic, or a cholinergic. Remember what cholinergics do? They rest and digest. And okay, the sympathetic, we talked about those drugs. Remember the increased heart rate and contractility and electrical? That's because it's the fight or flight system. So when you stimulate with those drugs, it's because you need to run or fight, right? Parasympathetic has the opposite reaction. So cholinergic drugs stimulate the parasympathetic system. What does it do? It has an acronym of SLUDGE. If you remember SLUDGE, it increases all of these. It increases salivation and lacrimation. What's lacrimation? Tears. It can cause urinary incontinence, diarrhea, GI cramping, and emesis. Woo! Sounds like a party, doesn't it? Well, these drugs are used to stimulate the intestine and bladder in people that may need that stimulation. It can result in increased gastric secretions, which results in the emesis or the nausea. The GI motility is increased, so if you get too much, you can have diarrhea. Increased urinary frequency can be the result of this. And these also stimulate the pupil to constrict, called meiosis. Meiosis is the constriction of your pupil. This helps decrease intraocular pressure. And when we get in another system, we'll discover intraocular pressure. Increased intraocular pressure is called glaucoma. So those drops that people use to fight glaucoma are cholinergic drugs. So that's a cholinergic. Then we have the various blockers. Let's talk about blockers. Remember, when a medication causes an effect, it's an agonist. When it blocks the effect, it's an antagonist or a blocker. So something that inhibits the sympathetic system, or the sympatholytic, or an adrenergic blocker, or an alpha or beta blocker, and you will hear alpha and beta blocker frequently. They are the low and slow drugs. They make your heart beat slow and less, with less contraction. I can't say that word. So those are beta blockers. They slow the heart down. Now, think about that. If you are stimulating the sympathetic system, it's for the fight or flight. What if you inhibit the sympathetic system? It's going to calm you down. People use beta blockers not just for heart problems like blood pressure, but they use it sometimes for anxiety, for performance anxiety. People that get nervous in front of giving speeches in front of people, or violinists who have to perform, they will sometimes take a beta blocker to slow their heart rate down, control their, slow everything down so they have better self-control. If you inhibit the parasympathetic system, also known as a parasympatholytic or cholinergic blocker, or the most common term, an anticholinergic. If cholinergics make you increase saliva, increase tears, and increase urinary frequency, what do you suppose an anticholinergic does? It's a high and dry medication. It dries your mouth. It dries your tears. So it slows your guts down. So a person who's having nausea and diarrhea, they might take an anticholinergic to slow all that down. So there's a chart in here of various organs and the sympathetic and parasympathetic response. So if you stimulate one, remember, if you stimulate one, you inhibit the other. You can't have both of them going at the same time. Think about it. With the sympathetic response in the eye, sympathetic response makes the eye dilate. Parasympathetic makes it constrict. You can't do it at the same time. One increases the heart rate, one decreases it. One dilates the bronchioles, one constricts the bronchioles. So you can't have both, one or the other. But if you look at this, look at that sympathetic response. I'm going back to the fight or flight concept. All of those reactions will help a person fight or run. Opens up their pupils, they can see more. Increases the heart rate, dilates the bronchioles so they get more oxygen in. Constricts the blood vessels. Why is that? In case they were attacked, they wouldn't bleed as much. It relaxes the smooth muscles, it decreases the GI motility, it stops it basically. It relaxes the bladder muscles, which can sometimes, if you ever seen a movie or something where somebody's so panicked that they wet themselves, that was the sympathetic response in their body, releasing their bladder muscle. So those are the sympathetic and parasympathetic responses. Adrenergic drugs are sympathomimetic. Adrenaline or epinephrine, very common. That's used to treat allergic reactions, especially anaphylaxis, bronchospasms, and cardiac arrest. These drugs get things working harder, right? So adrenaline acts on alpha-1, beta-1, and beta-2. It promotes the CNS and cardiac stimulation and bronchodilation. So if a person is in cardiac arrest, they may give adrenaline to open up the airways, to make the heart muscle more sensitive to stimulation. Adrenaline by itself will not start a stopped heart, but it will make a heart more susceptible to that electrical shocks to make it beat properly. It's rapidly absorbed, either IV, IM, or sub-Q. No matter how you take it, it's very rapidly informed. It also can be taken inhaled. Inhaled adrenaline is also there. It's protein. It is protein binding. It's found in breast milk. Unknown half-life, but it's metabolized by the liver and it's excreted through the urine unchanged. So we're going to talk. There's all the contraindications and side effects. We will talk about those in detail in class. Another sympathomimetic, albuterol. You'll use that all the time as nurses for asthma attacks. Some of you may have asthma, or your children, or your siblings, or your parents may have asthma, and they use Proventil or Ventolin or albuterol. They're all different names. These prevent and treat bronchospasms. It's inhaled. This affects beta 2 receptors, just beta 2. It's well absorbed. It's protein binding. It's got a half-life of 2 to 6 hours. PO orally, inhaled about 3 to 5 hours. It can cause a lot of nervousness, though. Remember, stimulating the sympathetic makes you nervous, makes you jittery. So inhaling a bronchodilator like this can make your heart race. It makes you feel nervous. It can make you feel flushed. It can do a lot of stuff. Some more medications: clonidine or Catapress, and methyl-dopa. You'll use clonidine more often than methyl-dopa. These are antihypertensives. They regulate the release of norepinephrine because they inhibit the release of that. They act on the alpha-2 adrenergic receptors. This is an alpha blocker, alpha-2. If you're giving these to a patient, you need to teach them about the side effects. You're gonna hear your heart's gonna race. You're gonna feel tachycardic or fast heart. Might have some hypertension. Could have dysrhythmias. Could become dizzy or headache. A lot of side effects. They're very useful, very important, but they do have side effects that you need to watch for. So some nursing implications. Well, you're going to be always assessing cardiac function and cardiac responses. So you can look at blood pressure and pulse. You're going to listen to the breathing. You're going to assess the person for how do they feel? Are they nervous or jittery? If you're taking inhaled isoproterenol, the sputum might turn pink. That's not blood. That's just a reaction from the drug. You'd never want to give, or you want to give very cautiously, 2 adrenergic drugs together, because it could result in a severe cardiovascular effect. In other words, you could have a hypertensive crisis. You could have a stroke. There's a lot of things you could do. So, careful. You are hoping to see decreased edema and increased urinary output. Adrenergic blockers. Remember, we talked about beta blockers, and there's alpha blockers. These have the opposite effect of adrenergic agonists. So this blocks and inhibits the normal stimulation of the sympathetic nervous system. It's a blocker. Alpha blockers have different effects on different parts of the body, and they are very protein bound. These cause arterial and venous vasodilation. They make the blood vessels get big. What happens when you have a bigger blood vessel? The pressure within the blood vessel drops. So these can cause your blood pressure to go down. It's used to treat high blood pressure and peripheral vascular disease and benign prostatic hypertrophy, Raynaud's disease, frostbite, IV adrenergic infiltration. Think about that. If you are giving an adrenergic and it infiltrates into the skin, it's going to cause localized damage, so you give this to reverse it or minimize it. These have been used to treat migraines and postpartum and post-abortion bleeding. They cause uterine vasoconstriction and increase the intensity of uterine contraction. You know, I have only given one of these medications. I've given Prazosin or Minipress. I've never given any of the other medications. So, but you may see these medications. You know, when I say I've never given, that's because I've only worked in Northeast Wisconsin. When you are nurses and you work in different parts of the state or different parts of the country, you'll discover that local doctors prefer a certain medication, and that's just the routine there. So even though I say I've never given it, it doesn't mean it's not used. It just means it's not used where I've worked. So just giving you that disclaimer. What are some side effects of alpha-adrenergic blockers? Palpitations, orthostatic hypotension. Hypotension. Meaning if you stand up quickly, your blood pressure drops and you can pass out. They can also cause tachycardia and edema. Much of the same symptoms as the other class of the beta blockers. Yeah. I lost myself. Sorry about that. Where was I? I'm sorry. I lost myself here. Tell you what, I'm lost. So let's come back for part C and figure out, maybe I can figure out where I was, okay? Thanks.